Hello, everyone. Please excuse my voice. I have been feeling a little under the weather, so I may have to take a few breaks in between just to kind of catch my breath. We're talking about an overview of TB, tuberculosis for healthcare professionals. We're going to discuss what is TB, the epidemiology of TB, the pathophysiology, so what TB is all about, the diagnosis and all that. Signs and symptoms, how it's diagnosed, treatment, prevention, and challenges. So what is TB? TB is an infectious disease caused by Mycobacterium tuberculosis. It primarily affects the lungs, but can involve other organs. The global impact of TB. TB is one of the top 10 causes of death worldwide, and it is prevalent in low and middle income countries. Some statistics. So annually, there are about 10 million cases of TB and 1.5 million deaths per year. The populations that are at high risk, well, anyone that's immunocompromised, anyone that has TB or that's in close contact with patients who has TB, people in overcrowded or low resource settings. The mode of transmission of TB is airborne droplets, so like sneezing, coughing. The stages of infection. So there's the exposure, where you inhale the droplets. There's the primary infection, which is the infection is localized in the lungs. There's latent TB, where the bacteria is dormant, which means that you have it, but it's not affecting your body. There's active TB. The bacteria multiplies, and you have all the symptoms, and you're very contagious. There's also granuloma formation to contain the infection, where your body tries to, the process to when your body tries to create a wall to contain the infection and kind of fight against it. So I included this from Everyday Health just to kind of give you a different breakdown. So the latent TB, no symptoms, you're not contagious. It's treated with antibiotics for 3 to 4 months. It can progress, though, to active TB. And then you have the active TB. You may have the cough, chest pain, and fatigue. Can be spread to others. It is treated with antibiotic combination for 4 to 9 months and can be deadly if not treated. Signs and symptoms. So persistent cough. You've been having a cough for longer than 3 weeks. Hemoptysis, coughing up blood, chest pain, fever, night sweats, weight loss, fatigue, chills, loss of appetite. How is it diagnosed? Well, there are a few ways. The first and most common is the PPD, or TB skin TST, which is TB skin test. And that's the little the picture up at the top right, where you see the needle is injected intradermally and it forms what's called a little wheel. And then you have the interferon gamma release assay, which is just blood work. You can also do a sputum smear and culture. Treatment. So the phases of therapy, the first one is intensive phase. which is the first 2 months, you have these 4 drugs: rifampin, isoniazid, pyrazinamide, and then ethambutol. And then you have the continuation phase. In the continuation phase for the next 4 to 6 months with 2 drugs, rifampin and isoniazid. So how do we prevent this from spreading? So you can take what's called a BCG vaccine. This is effective against severe forms in children. And then you can do something that's called infection control. Isolate contagious patients. Use PPEs, personal protective equipment. And then public health measures. Contact tracing and screening. Educating communities on TB prevention. If you have a patient or know anyone that has TB, educating them on taking and finishing all of their TB meds to kill the germs and stop TB. So what are some of the challenges that we face in TB management? So there are a few barriers: drug resistance, the stigma and lack of awareness of TB, inadequate healthcare access, and some of the concerns are co-infection. So a co-infection is when the individual has 2 or more pathogens. So example, HIV and tuberculosis, or COVID and tuberculosis, hepatitis B, hepatitis D, malaria, and HIV. Those are just some examples of what co-infections are. The impact of COVID-19 on TB detection and treatment. So let's do a little recap, a little case study here. So here's the scenario. A patient presents with a persistent cough, weight loss, and night sweats. Sputum smear is positive for acid-fast bacilli. So the discussion questions: what steps would you take for diagnosis and management? Well, remember, the most common is the TB skin test. You can do a TB skin test, or you can do some blood work. You can also do an x-ray. How would you counsel the patient on how would you counsel the patient on treatment and adherence? Well, you can explain to them the importance of adherence. You can explain to them the importance of completing their medications and taking preventative measures. You can address some of the barriers. You can also provide social and emotional support. In conclusion, so some of the key takeaways: early diagnosis and treatment are critical to control TB. Adherence to therapy is essential to prevent resistance. Prevention through vaccination, education, and public health measures is vital, very important. And what's our call to action? We want to stay informed. We want to advocate for TB awareness in our community. This concludes our training. Let's remember to always take preventative measures and help to protect ourselves and our patients.